We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together.
If I can be that little tiny bit of peace or hope that moving forward something's gonna be okay, even if it's just one little thing is gonna be okay, then I've done my job. You know, a medical facility, you have the right to advocate. You can do a lot more than you're probably given the choices that I think a lot of people don't know about, and that can be hard. Ask for those people, ask for a social worker, ask for a child life specialist, and they'll help you navigate those options. There are so many techniques that we can use now that we have learned don't traumatize children. We are doing our best to create these experiences in a positive way.
Not too many people know the heart of Foundation, and the biggest influence on all of the healthcare revolution and Foundation physical therapy and everything that we've done is you. You've been the one that's influenced it this whole time. Welcome to the Healthcare Revolution podcast. I'm so excited to have one of my favorite humans on the planet, my wife, Lexi Powell. Welcome to the podcast.
Thank you. So happy to be here.
I may have twisted her arm a few times to be on the podcast. She has a very unique perspective and a very unique role as a child life specialist in a children's hospital. And she has some incredible stories about what this healthcare revolution is all about. How would you define the healthcare revolution, Lexi?
You know, we talked about this a couple weeks ago, and I think I've worked in healthcare for 18 years now in various roles as a child life specialist, about 12 years. And I think the healthcare revolution means, to me, it means working together as a multidisciplinary team to provide the best care for our patients and families.
Yeah, I love that. I was talking to another physical therapist today. They were asking questions about, this new bill that was passed for physical therapists to be primary care providers. And he just said, what's going to change? And I said, ultimately, what needs to change is our mindset. That physical therapist needs to see themselves as an entry point in a primary role, but also we need to learn how to collaborate, how to create relationships with other professions, because we're no longer in the basements of physicians' offices and surgeons' offices. We are on the same floor. We're working together collaboratively as a team. You've told me many stories about advocating for patients, and that's what this episode's all about, is advocating for our patients as from a healthcare worker perspective. You've been in the system for a long time, and you've had many stories of both advocating for your profession and for patients. And we're going to talk about advice for parents and how they can stand up for themselves, but also do it in a respectful way, in a kind way, because working in the healthcare system is challenging, but it doesn't mean that we got to be rude to our patients. It doesn't mean that we got to, tramp all over them. We need to allow them to be in the driver's seat of the car. But first, let's talk about what a child life specialist is. Define that for us. Not too many people know what that is, and how many are there in the world?
So I looked it up this morning. The statistics aren't up to date. So I believe it was in 2021. There was around 8,000 of us in the world. That's roughly. So every year, I think they certify anywhere from, a few hundred. Right. So in the state of Utah, we currently have over maybe 100, and that's not all practicing in hospitals or healthcare facilities. So
100 child life specialists in the whole state of Utah.
Yeah. So when you put that into perspective with a nurse or an aide, ultimately those are a dime a dozen, right? Which they're obviously needed. We have so many of those for a reason. But in my field, we are maybe 1 to a unit in a hospital, and that's not even in a community hospital. So in a community hospital, you might have a team of 3 to 5 that's covering that entire hospital. Any child that comes in, or working with the death of a parent, or a really medically complex adult that has children involved. So to answer your question, a child life specialist is somebody who advocates for families and children in healthcare settings by providing coping techniques, education, teaching them how to navigate the hospital system, and ultimately, advocating for what they're going through.
What are some common misconceptions that you see in the hospital? I know one of them that kind of irritates you a little bit, and it's the iPad girl.
Called the iPad ladies, yeah. So when the iPad came out years ago, there was a lot of child life specialists that were in fear of their job because they felt like the iPad was going to take over their job. I remember being really early on in my career, and I had a colleague who was like, had been in the field for 20 years. And she was like, why are you afraid of the iPad? Like, we have so many skills and such a skill set that is specialized that this iPad device is only going to, it's just going to be a help. It's never going to take away any of our jobs. So it is kind of entertaining when doctors will say, I need the iPad lady, or I need the bubble lady. Right. Those are just some of our tools that we use.
Give us an example. We talked about, I can't remember the term that you used, but essentially when a child gets an IV and they're tied to a table in the past. Tell us how you feel about that and how child life specialists play a role in that.
Yeah, so child life came about in like late 70s, early 80s. Back then, hospital settings were very different. Families weren't allowed to be in there. Most of the time when children were admitted to the hospital, parents weren't allowed to even be there or be present for any experience, right? Tools were used like a papoose board where children were, it was a flat board. Children were wrapped to it and
so
ultimately
restrained.
Yeah, obviously times have changed. We don't do that. They're illegal now, thank goodness. But there are still things in the hospital that
don't you use them periodically still in certain cases?
Not in that same form. So it's very different, but and that's a totally different probably conversation. But ultimately, there are so many techniques that we can use now that we have learned don't traumatize children. The experiences that they're coming in for are so new. And even if it is a medically complex kid that experiences, a port access or an IV blood draw all of the time, it's still very traumatizing and very hard for them to process that depending on the age, that they are. But ultimately we are doing our best to create these experiences in a positive way so that they can go on to be adults and not be traumatized by their childhood experiences.
How many adults do you feel like were traumatized as a child and they're just terrified to go to the doctor or go to a hospital?
I have so many parents that will come in and they'll say, I don't even like watching my kid get an IV because I had such a traumatic experience when I was their age that it just puts me in a place that like I can't even be present with them because of my experience and how traumatic it was just over an IV. That is, I think, another hard thing is we have so many medically complex kids here where they're receiving transfusions or chemo or all sorts of, big things. So a lot of our healthcare team just thinks like it's just a blood draw or it's just an IV when it's not. That can be something that can be really detrimental for a kid to experience if it's not done in the right way.
Yeah, you think you're shoving a sharp needle in their arm. How is that simple? Right. That's pretty traumatizing even for an adult.
Yeah. I think as healthcare workers, it's so routine for us. And we sometimes forget that, this might be a new experience for somebody, for a parent, for a child.
Especially for a stranger to no one you've ever met before that's dressed in a white coat or, as a nurse in scrubs. It can be scary. You've never met them before and they're going to shove a sharp object that hurts in your arm.
Right.
Especially as parents, we kind of, even vaccines, it's such a routine thing. It's just like, you just get it done. And some moms won't even go in with their child to get a vaccine. But who, in your mind, who are they most comfortable with?
Oh, 100%. Their caretaker, whoever it is that their primary caretaker is, I would say is their most comfortable person. Every now and then, that can be somebody like a child life specialist. It depends on if it's a chronic kid. I've had kids that were on dialysis for years and years. And one particular patient I had, actually, she was at end of life. She requested me to be there as she was passing away. I was the person that was holding her hand. So it just depends. Like I had the time with her. I experienced things with her that maybe her parents didn't, and that didn't take away from their relationship. But ultimately, parents know their child best. And as a child life specialist, it's great. We have the time. Yeah, I think that's the difference is we have the time that physicians don't have, or even sometimes nurses don't have to gain the rapport and the relationship with our patients. Yeah. So that is why we can be such big advocates for them.
Yeah. And ultimately, in my mind, the child life specialist is really a deep advocate for both parents and children. What would you say to that?
Yeah. I mean, my perspective as a child life specialist, we all do our job differently for sure. But I always go in trying to build that relationship with the parents and the child, even if it's done in a quick manner. Currently, right now, I work a lot in the emergency department. I don't have a lot of time to build rapport, but I've noticed if I take the time where maybe other professions can't take that time, it can make a world of difference for their ER experience. Yeah. Just by getting to, listening to them, validating their emotions. I mean, validating is huge in our field. If you can just validate what they're saying, I can then take that back to the healthcare team that I already have a great relationship with, that those parents might not have a relationship with, and I can then advocate for their needs. Yeah. And I think that's what is the most beneficial thing about our field, is that we have the skill set to not only work with these very highly educated medical professionals, where a lot of parents are very intimidated by that. Yeah. Even if they've been involved in it for, years to come. I just listened to this experience of a mom who has a trisomy 21 patient, or her child is the patient, and she has heart complexities. And she said, I've been dealing with this for 4 or 5 years. I can't remember how old her child was. And she said, I still feel like I'm going through it. Every single time I go through it, I have to remind myself how to navigate this system. And the child life specialist who was interviewing her said, that's what's so great about relying on people like us. You think, okay, I can rely on these doctors. They have a different job. Yeah. And ultimately, I respect their job so much. I could never do their job. But in my field, I can then be that advocate and relay messages that these parents sometimes can't get out,
Exactly. So. Yeah. You work. Tell me about your relationship with doctors and how you communicate between, say the patient is really worried about something or the patient's mom. How do you relay that to the doctor?
Yeah, it's not always easy. It depends on,
We'll go into some experiences later, but what's your role there in building that bridge?
Yeah, I think my role is very important there. I think it's really crucial that I get to know these doctors, spend the time to share my profession and research so that they know that there's research to back up what I'm doing. Ultimately, I always tell doctors and nurses, if I'm not helping you out, then I'm not doing my job correctly. If I'm not doing something to make your job easier, then I'm failing also. And so how can I ultimately make your job easier? Yeah. That then puts that a little bit more in their court. We're not always super well respected just because of the time that maybe we spend that they don't.
They want to move.
Yeah, they got to get through people, and that totally, I respect that. It can be challenging though to spend the time that I need to get to know these patients and what they're going through, and then also communicate with the physicians too.
Ultimately in healthcare, I think the biggest thing that we struggle with, and it's really hard, is Stephen Covey talks about in one of his books the difference between being effective and efficient. And he talks about how we are effective with people, but we're efficient with things. And in healthcare, there's so many tasks, so many things that we have to check off. We kind of get stuck in this efficient world. And when we forget, when we're working with humans, we need to switch gears and say, we need to slow down. Right. Be fully present with these patients and ask about their concerns, validate them, educate. And part of your role, one of them I really love, that's always stuck with me, is when you talk about these dolls that you'll bring in. You'll go talk to the doctor about the procedure, something that's happening, and you use a doll to teach these kids about what's going to happen so they're mentally prepared and know how to cope beforehand, right? Mm-hmm. And you help figure out coping strategies of, breathing techniques that they can get through it. Tell me a little bit more about that.
Yeah, 100%. So it's called medical play. So we use real medical supplies to educate children and their parents through what they're, about to experience. So if we, for instance, have a EEG where they're doing a scan on the brain to navigate seizures, right? We can take a doll, we can put all those leads on the doll, and the child ultimately acts as the healthcare professional, right? And so it's really cool because they then are in the driver's seat. They can...
So you have the medical terminology background to be able to show them what this brain scan looks like. You have the equipment on the doll so they actually can physically see it, and then it decreases their overall fear about what's going to happen.
Yeah, so if they can handle the medical equipment, they can feel it, they can use it in a safe way. It's all, monitored by us, but then they ultimately feel empowered to experience this in a way that, I know how to now navigate this. I know what it's going to look like. I know what it's going to sound like. I know what it's going to feel like. All of the sensations, even if it's smell, everything that they can experience before, so they're not surprised. We hate surprises in our field of work. We don't want to surprise the kid. We want to make sure they're prepared, really, in all of age groups. So we can do that anywhere from a preschool age kid all the way up to our late teens. And sometimes we underestimate what kids need and how much preparation they need.
Especially the teenage boys.
Oh yeah.
That's tell us
they're
a little about
my
your teenage
favorites.
boys and why they're your
I love my
favorite.
teenage boys. It depends, right? If you're talking about our chronic kids, I've had a lot of experience in the chronic field with kidney failure. And I had a lot of teenage boys on dialysis, having to get accessed, very large needles, very scary procedures, ultimately leading to a kidney transplant. And some of my teenage boys have been taught, like most men, to not cry, buck up, figure it out, and really breaking them down.
Don't be scared.
Getting into that emotional intelligence of really knowing what those emotions are that you're feeling inside and being able to express them in a way that, we can help you process these. So later on, we don't have that trauma. We don't have those built up, emotions that we didn't get to work through as a teenager and that come out later on in life. So
give us an example of a boy that you had, maybe a story what coping strategies did you give him? What did you teach him to help process this? Because, masculinity is taught in our world of, just like you said, like, just be tough, don't cry, suppress those feelings, be a man, all these things. But what are some things that you've done? Maybe give us an example.
Yeah. One of my favorite things to say, even right now in the ER, just as with really short, small procedures, whether it's like stitches or IV, is a lot of healthcare professionals will say, it's fine, everything's fine. And parents always say that. It's fine, they cry. I always gently talk over them and say, actually, it's not fine. I can tell how bad you're hurting. And I turn that on them and I validate what they're going through. I can see,
manner, right?
Yeah, for sure. And, I do my very best to not, speak over a medical professional, because I do 100% respect their role and what they're doing. And they have a skill set that I don't have. Mm-hmm. This is my skill set, is language ultimately too, learning how to speak to kids in a way that they understand. We call it soft language in my field. So that it, it can be processed in the right way. So yeah, letting them know, I see that you're hurting. I see that you're in pain, and you're right. This is not okay, but we're safe. We're safe people. We're here to help you. I know that you don't feel good right now. I know that you're in pain, and we see that. And that's why we're here to help you. Mm-hmm. So navigating that conversation in a way where it's like, I don't want to make the doctors or the nurses look like the bad people, because they're not. Yeah. They're helpful, and that's what they're doing. But letting the child know that their emotions are also real and what they're feeling is real.
Often, what are some examples of things that maybe healthcare workers or patients have done? You gave one of like, it's fine. What else do we do as parents and healthcare workers that suppress these feelings that these children have? I mean,
we ultimately don't listen to the child, right? We just, as adults, we often forget that these children are smarter than they are, and that they have a voice too. Something that we use in our field is called one voice. And that is a technique which I think can be used in so many areas, parenting, any healthcare situation, right? Sometimes we're so overwhelmed by the voices that are going on. Everybody wants to be the hero. Everybody wants to throw out their bit of information and their specialty and their advice, when ultimately that's just so overwhelming for a person. Even as an adult, we can't process that much information. Mm-hmm. A child definitely cannot process that much information. So narrowing it down to one voice, whoever that might be. I've been in traumas before where we're resuscitating a patient, right? That's not my job to ultimately resuscitate a patient. So why would I be speaking up at that point? Why would I be causing more complexity to that situation when that's not necessary? Yeah. Now there's other situations where we're placing an IV. The staff has done this a million times. The parents are overwhelmed. The child's upset. I then get to be that one voice. I can be that calming voice for that child, explaining the procedure step by step, rehearsing our coping strategies, going through whatever steps we talked about with them, or using diversion and distraction to keep their mind off of it. Mm-hmm. And then letting the healthcare team do their job so that we're not overwhelming that patient with with so many voices.
Yeah, you told me a story of, I think it was Owen, our 9-month-old, that you took to get vaccines, and you were advocating for him. Tell us that story.
Oh, this was actually with our 3-year-old, Liam.
So this is as a parent,
Yeah.
you know, it's easy for someone that has expertise in this area to advocate for your child. But I think this is a great example of being kind, you know, being stern, and essentially advocating for your child. Tell us about that story.
Yeah, that was a hard one for me, because being in my field, I have gained a lot of respect in certain units, and people that I've worked with for a long time who know me, they know what to expect when they see me coming. Where here I was at my general pediatrician's office with my child as the mom, and I ultimately said I would like to place my child in a comfort hold, which is something that we use in the hospital. It's a hold. It's a position where a child can sit with their caretaker in a comfortable way instead of being forced onto their back or restrained. They can be there's a few different ones. This in particular one was like a bear hug. So that was where we were chest to chest, and his legs were then exposed on the other side. So I was hugging him ultimately. And the medical assistant said,
and this was to do
just a routine vaccine.
Yeah.
The medical assistant said, "Oh, I can't do that." And I said, I kind of had the like flame lit in me a little bit, like, yeah, you can. I know you can do that. And so and
you've been a medical assistant and a child life specialist, so you know both ends. You're like, absolutely you can. So, I know your job. I've been a phlebotomist as well.
Right. I said, I know that this can be done. And I said, ultimately, I'm a child life specialist. I do this all the time at work. If you don't feel comfortable, I know there's somebody in this office that can do it. So if you don't feel comfortable, that's totally fine, but I'd like you to go find somebody else. That was a good learning experience, I think, for me too. And I've actually done that with a few of my patients.
And that was so kind. I love the way that you did it. It wasn't rude. It wasn't forceful. It wasn't aggressive. It was purely like, I've done my research. I know that we're able to do this. If you're not comfortable with it, I can find someone else.
Right.
Right. It's just like a plumber coming to your house and you're like, and they're giving you some other recommendation. And it's like, I don't want the design that way. If you can't do it the way I want it, I'm going to find a different plumber.
Right.
But then all of a sudden in healthcare, we just give up the keys to the car. We're just like, okay, you can drive.
And I love to teach, I love to educate parents on that ultimately. I've had several situations in the emergency department. Like I said, it's really fast paced. It's quick. We're getting in, out. And I always educate my patients after. If it didn't go away that we wanted it to.
It's almost like a debrief.
Yeah, I always say, you know what? You as the parent have the right to advocate for your child.
Yeah.
You have the right to advocate for yourself. Also, if you're going in as an adult into a medical facility, you have the right to advocate. You can do a lot more than you're probably given the choices that I think a lot of people don't know about, and that can be hard. Ask for those people, ask for a social worker, ask for a child life specialist, and they'll help you like navigate those options. I think that's one thing that has been really eye-opening for me as a professional, is that so many parents they're not even aware that that's an option for them. And so I've kind of taken that into my role and my duty to then educate these families on how they can navigate maybe the next experience. Because if this one didn't go well, hopefully the next one can go better.
Yeah. And when the parents are really advocating well for them and their families, what does it do for you essentially as a provider role? Oh,
it's so empowering. I had a experience a couple weeks ago where we had a patient code in the ER and did not make it. That's obviously always, that's obviously our worst case scenario. Those are really hard for all of our professionals. Afterwards, I was really, really impressed with the team. This is with Primary Children's in Lehigh, and we did this debrief where we all got to kind of talk about our role. And so
this is after the child passed away. You get together in a room and you discuss in this debrief. Everyone speaks.
Yeah.
Like what went well, what could have gone better.
Each discipline got to speak. That was one of those moments in my career in all 12 years where I was completely blown away. Like, I actually am important here, right? I've always felt that way, but to be perceived that way by more educated, professionals.
Yeah, we say more educated.
Yeah.
Yeah, with a bachelor's degree, right? You have just as much education as a nurse does.
Right. Sometimes more. A lot of us have master's degrees, which doesn't mean everything, right? Work experience.
It doesn't put you on
just
this totem pole of lesser or more than. Everyone has a role.
Yeah.
Everyone has a specialty.
It was really empowering to see this meeting be led in a way that each individual, all the way down to like environmental services. And I just thought it was so cool how empowering that was to see us all work together as a team. You know, you talk about the healthcare revolution and what that means. That moment was healthcare revolution. That was a moment where every single person's voice mattered. And that was still our outcome. Our outcome was still the child had passed away. The child did not survive that situation. But what that did for that team is it made this community, that night, that team was just bonded by something. And it's not because of what happened. It wasn't because it was a really hard thing. It was because of the way they worked together. It's the way they use each individual person to navigate that experience, right? Yeah. We're human. Not every child's going to make it. Not every person's going to make it as we, go through life. That's inevitable. And so
what happened in that circle that night? Like what did everyone say? And like, what did you say? What was the feedback afterwards?
Yeah. Everyone was so kind. That was the one thing that I noticed was they spoke about all of the really good Obviously we brought up things that could have gone better, that it's a learning experience.
Yeah. Cause debriefs are not to point fingers.
No.
It's purely, let's talk about it. Let's talk about how we can more efficiently do this next time.
But it was so cool to see.
And not that it was the team's, they did everything in their power, it sounds like, for this child.
100%.
And the child ended up passing away. But the whole idea is to create maximum efficiency. Yeah. Right.
And to see the respect between each profession, I thought was incredible. Oftentimes we don't give credit where credit's deserved when it comes to the hospital setting. You've worked in the hospital before, the feeling of, not feeling respected maybe, or somebody not giving you credit where credit's earned. And that's hard. It's hard to work as hard as we do and not receive that, right? Not receive that credit. But ultimately it was a moment where everybody was able to express their appreciation for one field to the next, and how they helped each other ultimately get through that. And it, they got to me and I was like, I was there. I was prepared for my role, which in that situation obviously was my hopes were that child would survive. Ultimately, my job was then to make memory-making items for this family to take home. And a lot of times the healthcare team doesn't see that. They move on, they go to their next patient. I stay with the medical examiner. I then create those things. And to have the doctor respect that and just say, how you kind of close that loop, and what that does for us, and how that sends those families home, is a message that, they take. That's a feeling that they take with them. And that's a reflection on all of us. That's not just a reflection on you.
You represent the entire team in those last moments.
Yeah. So to be told that, and to then see how we worked as a multidisciplinary team was very, very rewarding.
Yeah. And we talked about this. You've dealt with over 100 end-stage life cases, and about 20% of them actually passed away. Is that correct?
Oh, no, all of those.
Oh,
yeah.
All of those passed away.
Yeah.
And so you've held a lot of babies that have passed on.
Yeah.
And what's your role in that after they pass away?
Yeah. So part of child life, like I said at the beginning, is anywhere from playing with a child to get through a simple procedure like an x-ray and diverting their attention so that they can cope, to experiencing end of life, whether that looks like, carrying out their wishes, explaining to their siblings maybe what that's going to look like, creating memory making items and legacy items for their families.
Give us some examples of those. I love the hair locks. I love the handprints.
Oh yeah. So, depending on the age, NICU babies, we do foot molds and hand molds. Those are like
after
the 3D.
After the baby has passed away, you'll go and made some hand molds and foot molds for the family.
Yeah. Yeah. A legacy item that they can take home. Charms, pendants with their handprint or footprint.
Kind of like decrease the size and make a necklace out of it, right?
Yeah. And I've worked in not only the hospital setting, but also a long-term care facility where I had a little bit more leeway on what I was able to do. I had a little bit bigger budget and that kind of stuff. And ultimately, there was a time that I did a 3D hand mold on a family of 6. So there was 6 hands all interwoven together of a mom who had passed away and all of her children. So her family then could have that after she was gone. And these types of momentums don't mean a lot to everybody else, right? But to that family, that might be the last piece of that person that they ever get to have.
Yeah. I mean, you know, this side, one of my patients who was, her husband was one of my friends, and she was, came in for back pain, we found out she had cancer, and she, you know, the whole story. But there was a few days before she had passed away, I just had this feeling I needed to reach out to him and go to lunch and just see how he was doing. And he just said, my wife's not doing well. And I said, well, let's go over and see her, you know? And I saw her for that last time, and I thought to myself, what would it take to get her in the sun one more time, you know? And we got her out of bed. It was so hard. It took us an hour. And we got her out in the sun, and she had the biggest smile in her glasses, and we still have a picture of this moment. And he reached out to me and said that last moment was one of the most special moments that I remember with her. And these are the moments that you're creating with these patients, these last moments where you essentially closure. They've gone through this traumatic experience of losing, you know, from what I've understood from you, grief. The hardest thing to ever lose, the most deepest grief is losing a child, right? That just happened to them, and we just wrap it up, close the doors, and see you later, right? But then you sit in those hard moments with these families and help process this, give them these legacy building type things so they can remember these children and the part of their family and help them process it. Tell us about what you do as well. You're creating these items for them, but what are these conversations like in these last moments? What else are you talking about? What else are you, explaining with these parents and these children?
Yeah. Ultimately, in my role, I work really closely with social work. So they're going to be the ones to provide resources outside of the hospital, moving forward once they leave. As far as my role goes, if there's siblings involved, my role is to sit in that moment with those siblings and really process these emotions. So, emotional intelligence is not something that a lot of humans are good at, which is unfortunate. I don't think it's something,
intelligence for us.
Ultimately it's knowing what your emotions are and how to handle them. So giving them a name and knowing what they feel like and being able to cope with them in a healthy way. Yeah. And we're not good at that. We're not good at that as humans. We're not good at teaching that. It's something that we ultimately avoid and is such a disservice to us. And I love working with siblings after that, because a lot of times they get neglected. They don't get the attention right off the bat. Mom and dad are grieving.
They're not really sure how to process it. How are they supposed to, even acknowledge the children in the back of the room?
Yeah. And helping them, kind of process that, finding activities where age appropriate activities where they can process those emotions. One of my favorites is like a memory box, so they can talk about some of their favorite things about that person, and then they can take that box home and they can use it to fill with memories that they've had of their brother or sister, or their loved one, even if it was a parent that had passed away and we're now working with the child. There's so many different ways that we can do this.
You have so many tools. I mean, the example that I used of my friend's wife that passed away, you worked with his girls.
Her children, yeah.
And what was some of the stuff you did with them? I know you kind of created some pictures.
Yeah, we did some art canvas.
You knew that it was one of her last days. I think it was 3 or 4 days where she passed away, and you did some canvases.
Yeah, they were very artistic girls. I helped them make.
So essentially, you do an assessment. You figure out what they really like, what they enjoy, what core memories they have with their mom, and then you create something that is important to them.
Yeah.
It's so amazing.
A lot of times those moments are a blur for families. They're going to look back on those and not remember a lot of the things.
Yeah, many people are like, give me a bunch of YouTube examples of some crafts that I could do with my kids in these end stage moments. And you're like, there's so much more to it.
Right. And my goal is always to create an experience, not so much okay, I'm going to teach you something that I'm expected you to, I'm expecting you to remember this. It's probably not going to happen. I want you to remember this moment as something, if I can be that little tiny bit of peace or hope that moving forward something's going to be okay. Even if it's just one little thing is going to be okay, then I've done my job. If I can, create an experience where they can look back and think, I remember that moment where I felt just a little bit safe because my world just ended ultimately. Right. Yeah. And so that's my job. I know that's a lot of my colleagues' job too. That's their goal, is to create those moments for these families and to sit in that hard. Sometimes that's all it takes, is just sitting in that hard with these families, with these patients, and remembering that, this is our job. This is why I went into this field. Going back to advocating for our patients, a lot of the other healthcare team, they don't have to do that. That's because that's not their job, right? And I don't have their job. And so I'm always grateful when I'm given that moment, when I'm given that time to sit in the hard with those patients and ultimately use my skill set and my expertise to then do that. And that's how I can advocate for them.
Yeah. I know this is a really heavy topic, and we could feel it as we talk about it. End stage life of a child. How do you, as a healthcare worker, process this? A lot of people ask me, like, how does Lexi do that? It just seems so hard and so dark. What's your coping mechanisms personally?
I think that having a good team makes a big difference. My team at Primary Children's is amazing. We have
You're talking
great
about team as in me, right?
Yeah. No, obviously I will get to family, but my teammates, right? They experience it. They're the ones that know what it feels like. That night that I had,
they sit in it with you. They saw it.
And they experience their own end of life cases that I don't experience, right? So they know what that feels like to process with the family, go through it, and then go to your office and break down and cry, right? They know what that feels like. And then they know what it feels like to pick up the pieces, wipe away the tears, put on your professional face, and go out and serve another family.
Immediately after. One that's complaining and yelling.
And that Sunday, that in particular Sunday that I lost that patient a few weeks ago, I actually had 3 deaths that day. That's not
all in one
that's
shift.
Not super common. That's not
3 children.
that's not something that happens every single day.
Yeah.
But it was hard. And the next time I went to work, I had a little message. It was just a short little post-it message from my cute friend in the PICU, and she said, "I'm so grateful for what you do. I hope you know that you make a difference." And just reaching out like that, those small moments, they carry me through so much. So ultimately, I think, this might sound weird. It's a calling. That's what I was sent here to do, is this job. So I think that's why I can process a lot of these things better than maybe some people say, if they haven't gone through it. So I'm sure they could do better than they think they could. But there's times that are hard, right? We've talked about burnout and what that means. Burnout in my field is very different than burnout in other fields. Burnout, compassion fatigue, it's just very weighing. It's a lot to experience this. But taking the time for yourself, whether that's taking a step back, realizing, I'm not a full-time child life specialist right now. I'm PRN. I have a family at home. They come first, but I love my job. I love my career so much, but taking that step back to just work a few times a month is ultimately, enough self-care that I can move on, and I know I can serve those patients in that moment, and then I can go home and I can get through that.
Yeah. What are some things you do in that time off to process it as well?
Talking to people, spending time with my family, friends. And I'm a very open person. I love to talk. I love to express. Obviously, I can't share a lot of details with certain people about those experiences, but I can talk about it. And I'm a talker. Not everyone is that way. I like to talk. I like to explain. Yeah. I like to kind of work through.
You process it by talking about it.
I like to work through the experience, and I love to spend time with my children and take advantage of the time I have with them. It's something that, I have this good friend that I used to work with in the emergency room who is now a very popular influencer. And, something that she said was never take advantage. My goodness. Never take for granted your time waiting for a healthcare provider in an office. We get so frustrated that they're taking too long, or that night that I had that code, one of my jobs that night was to go around to each room and say, like, I'm sorry, we're going through something right now. They're going to get to you as soon as they possibly can. Thank you for being patient and waiting. And I kept reminding myself, what would I do in that moment? What would I do as a patient, as a parent? Maybe I came in for strep throat or something, that needs attention, routine. But it's also minor compared to what's going on in the trauma room down the hall. Yeah. Am I going to be upset? Am I going to be angry? And as a patient advocate in that moment, I kept reminding these parents very tactfully, be grateful for what you are here for. There's something really heavy and hard going on right now, that's taking a lot of time and a lot of professionals away. Just,
sometimes it takes 10 to 15 people for these cases, right?
Completely shut down the entire, it shut down the entire ER. It's something that I haven't seen in a really long time.
And to have 3 in one night. Literally, we had wild.
two other professionals, nurses, techs running the rest of a 20-bed ER, right? Yeah. So, it's just a good reminder that you're not going through the hardest thing that's going on right now. Yeah. And you might have to wait. It's hard to be patient in those moments. And yes, you matter. Of course you matter. We're going to get to you, and it's very important, but ultimately be grateful, because there's a lot of hard that you're not experiencing right now that somebody else is.
Yeah. I'll never forget the one code that I was a part of when I worked at a hospital. In my job, the patient had got pinned between the toilet and the wall. It was a really small bathroom, and she coded, and they ran and got me in. My role was to essentially transfer the patient back to the bed so that everyone could do their job, because, that was my role, is to transfer patients and get them safely to places. So I did that, got them up. The nurses took it and doctors took it from there. And I walked out of the room, and one of these patients down the hall was screaming, "I need my Dr. Pepper," right? And just kept hitting the button, screaming from their room. And the nurse, who was a good friend of mine, came out, and she was just sobbing in tears, processing what had just happened, and ended up, they saved the gal's life. But she wiped her tears and walked into the next room, didn't explain anything to the patient, and just said, "I am sorry it's taken me so long. I will get you your Dr. Pepper."
Yeah.
And if that patient knew what had happened just barely, right, how would that have changed their perspective? And these parents that are frustrated, which is totally understandable. You're in the ER for multiple hours sometimes, but you don't know what these healthcare workers are going through. You don't know what they just had to process, and they're doing their best, right, with the circumstances that they have.
And, going back to the beginning, we talked about what it looks like to advocate as a healthcare professional and advocating to other healthcare professionals. Leading by example, that's one thing that has spoke volumes in my field, is leading by example. I will make it very well known that I will go talk to patients, and I will make sure a nurse is in that room that maybe you can tell isn't really super happy that night, or she's had a hard shift and she's not super bubbly and engaged. And I always make it a point to say, like, thank you for being patient with us. Our staff's working really hard tonight. We're super overwhelmed and busy, but we're so grateful that you're patient with us right now. Yeah. So that nurse can then see, like, oh, somebody actually sees me, and I always try to thank the healthcare providers that I'm working with, whether it's the doctors who might not have had a single second to even look at me that night. Techs can go a long way. Sometimes they're overlooked. I had one that just came up and gave me a huge hug one night, and he said, "We're so glad you're here." And what that did for me, as cliche as that sounds, like, kindness can go,
your energy matters.
Oh, it 100% does.
And it's so contagious when healthcare workers are kind to each other and uplifting, And
that takes time. I mean, for sure. Like, we have a new team where we're, and I'm not even there full time, so I'm not necessarily a part of the team, but being kind and recognizing people, remembering their names. I mean, for heaven's sakes, if you just remember nurses' names and techs and doctors, like, if you go up and you're just like, "Hey, so-and-so," it's amazing what that relationship can do that night and how differently they respond to you. They call you when you're needed. They say, "Oh, I remember Lexi's here tonight, and I have a suture that I need help with. I'm going to call her." Where before it's like, if I just sit in my office and wait for them to call me, I can't, I have to advocate for my own role all the time. So I'm very used to that.
And there's two examples that I want to talk about today that I've really loved. One just has just hit me deep about the healthcare revolution. But let's talk about your role when you had you were in a room and you got dismissed by a doctor. Let's talk about that.
Yeah.
And then I also want to talk about what you did after to build that connection, because essentially you got excused. What'd you do?
Yeah. So I was a new child life specialist. I'd only been out about 6 months.
New
so
grad. Here
not
we go.
only was I terrified to have an experience like that, but I was in a community hospital up at McCady Hospital in Ogden. So those are a lot rougher crowds than a children's hospital.
Yeah, a lot of gunshot wounds, a lot of gangs up there.
Not only do they not...
A lot of people don't know that, but it's pretty wild. There's a lot of gunshot wounds up in
Not only
Ogden.
do, you're not in a children's hospital. So you're not seeing, there's a lot of adults that are coming in that you're not seeing. A lot of the healthcare staff don't know what a child life specialist is. So not only was I kind of just in this like fog and really advocating for myself. I mean, I have a list of all the people that come in. I'm navigating who to see. I see a child that's come in for a very routine, I think it was a fracture or stitches or something like that. And I always tried to go in ultimately with the doctor. I've learned, my ways now, but I went in with the doctor. And as I went in, he looked at me and he said, "You're not welcome here," in front of the patient, in front of the family. And he said, "You can leave now." And honestly,
you gotta be kidding me.
Honestly, I was stunned. And
in that moment, your heart rate rises, like your blood pressure goes up, like you just get all flustered.
Yeah.
Like I've been there before.
Yeah.
How'd you navigate this?
I mean, first thing that came to mind was my my awesome person in leadership that had, one of my mentors early in my internship. She had said, "Remember that you always have to advocate for yourself and these patients." And I said, okay. So in my head, I'm sitting there and I'm like,
Deep
my
breath.
job is to advocate for this family right here. I know the skill set I have and how I can serve this patient and how I can better their experience tonight. This is my job. I was given this role by the hospital. I, of course, have the right to be in this room.
Yeah. So those are the thoughts going through your head. And what did you say?
Turned around and I said, "I'll wait till you're done. Like, I'll let you have your time. But I've been given this position in the ER by the hospital, and I will do my assessment
Just
once
like you have.
once you leave." Yeah. Oh, he didn't love that at all, which is fine.
'Cause essentially, he excused you, and you said you advocated. You said,
Yeah.
"No, I've been hired by the hospital to be here. You don't have the right to excuse me."
Yeah. So
but you said it in a more tactful way.
Yeah. So he stayed. He did his assessment. He looked at me with daggers and then left. And
that was
very uncomfortable, right? To be with the patient then.
And for the patient to see that, like, it's uncomfortable for everyone.
And I apologized to the family. I remember saying, like, "I'm sorry about that." I said, child life specialists are relatively new down here, but I want to explain my role and what we do so that you don't, like, you feel like I'm a safe person. Sometimes people think we're from like Child Protective Services, and that's the farthest thing from what we do. So ultimately I just sat down and I said, I'm new to this provider as well. And this is what I do. If this is a service that you feel comfortable with, I would love to serve you and your family. And so we then, prepped the kid for his IV, moved forward. Everything went fine. Later that night, I went to...
And I really want to emphasize what you're going to say now, because this is the part that everyone in healthcare needs to see. Like, if you are listening to this, I hope you listen to this moment and realize it's you confront things,
Right.
but then you repair it. You build the bridge. The revolution is all about building the bridge. Work together. My goodness, we all have disagreements. We all have, our own values and the things that drive us. But ultimately, we are here to work together.
Yeah.
So I love what you did next. Go ahead and tell us.
Well, that night, my mentor that I was talking about, she actually was working with me, and I went into the office and I lost it. I was so emotional. I just started bawling, and she was like, "Well, what are you going to do to fix it?" And I was like,
you got to repair it.
Fine.
Let's go.
I guess I have to. She always, Casey Davis, if she ever listens to this, love her to death. But I said, "You're right. Like, I have to do these." She's like, "You're going to face a lot harder things than that. You got to have some thick skin. You got to toughen up. Like, you can't take this personal." And I thought, yeah, you're right. Like, I need to go face him. I can't work in this ER every single night. I was full-time then,
it,
or else I'm not gonna
it.
So I went up to him and I said, "When you have a moment, I'd love to talk to you." And he said, "Yeah, after this patient, whatever." So we find a time, we sit down and I said, I want to explain to you what we do. And I said, my job is to help make your life easier too. Yes, I'm here for these patients 100%, but I'm also here for you too. I'm a part of this team and I would love to find a way to work with you, whatever that might look like. It might not look like what it looks like with the other doctors in this ER, but ultimately I know that I can create a team with you and I can make your life easier. Were we best friends? No. But did he excuse me from a room again? No, absolutely not.
And did he respect what you did?
I don't know, but I hope so. I hope over time. I know the child life specialist that came after me. I know she did a lot of great work, and it was building a foundation for the professionals to come. Yeah.
And ultimately that's not okay. If you have a disagreement with another healthcare worker, don't do it in front of the patient.
Right.
Be respectful. This is a team, the patient included. We should all be working together, not have disagreements, not dismissing people, not being creating arguments with each other. Like ultimately, those conversations are outside the room. If you disagree with each other, don't be having it in front of the patient, because there's nothing that'll decrease the trust of the patient to provider than seeing a provider dismiss someone else.
Right.
Like, I can't imagine what that patient must have felt. Like, should I even trust this doctor?
Yeah.
Right? Show some high-level emotional intelligence as a physician and resolve that later. You don't have to be dismissing people. The times have changed.
Right.
I have one more story that I loved of yours. This is the one that I've loved the most. And it really highlights about, again, back to the revolution. You had this patient come into the emergency room. The doctors had run all their tests. She had been lacking sleep for multiple days. Young gal, maybe teenage years. And she went through all these procedures. The doctors did everything they can. What did the doctors do to involve you at that point? And what happened?
So they came to me and they said...
And this is after they ran every test,
right? They
said,
we've pretty much done everything. She's having some really severe pains in her legs, but from the knee down, she has heat packs on right now. She switches to ice packs. Ultimately, there's nothing in the tests that are coming up that prove that she's actually having real pain. So they said something to me, actually with the mom. They said it might be in her head. And I said, I kind of took a little deep breath and I let the nurse
say that to a patient, even if you believe that. My goodness, you never say it's in your head.
Let the nurse do her
that means
thing.
You're making it up to the patient, right?
And I did. I said, and she left, and I said, let me just work with her for a minute. Let me just talk to her. Let me get to know her. They said, we're in no rush. She's admitted, take your time. We don't need to do this urgently. We just cannot. They were talking maybe advancing to behavioral health care, sending her to the psych unit, which is really hard. That's not what she came in for, right? She didn't come in for mental health. And so I started talking to the mom, and the patient was kind of in and out of conscious
what
sleep.
Did you say the doctor said? He actually came and grabbed you and said, can you go do an assessment?
Yeah.
Is that correct?
Yeah, yes. Yeah. He was very, very team approach. Definitely.
So awesome.
For a doctor
to say, I've done everything I can in my role.
Yeah.
Who else we got?
Yeah.
What other teammates? What other resources do I have?
Yeah.
Because I'm not the answer for everyone.
Right. And he was amazing. I commend this doctor. He did a great job, because ultimately he had exhausted all of his efforts and done everything that he could. So this individual, she was very upset. She would kind of wake up and scream, just be in extreme pain. And her mom just didn't know what to do. She was at a loss. So I said, there's a few things I can do. We kind of talked about guided imagery, which is a way of just, walking a child or a patient through a scenario that kind of puts them into a really calm state and helps them
You say through, like an altered state, or just getting them to not think about what their current state is.
It's a pain management technique that we use to get through pain and lots of other maybe challenging situations. So we're talking about that and what that looks like. And I'm watching this girl from the corner of my eyes. I'm talking to the mom, and I just see her going in and out of sleep, and just, I can tell she's waking up, but in a lot of pain. And I looked at her mom and I said, how many hours? You guys have been here 2 days. How much has she slept? And she's like, she hasn't slept since she's been home. She does these bursts where she goes to sleep for maybe 10, 15 minutes. And I went back to the doctor and I said, have you given her a sleep aid? Something that can get her.
You were talking multiple days with very, very limited time of sleep.
Yeah. Just the basic a basic thing that we need to survive is sleep. You know, she's had food, she's had fluids, she's hooked up to fluids, she's had pain meds. I mean, we were talking some heavy pain meds too.
And it's not influencing her pain at all, right?
No. And it wasn't helping her pain meds. So, back to in her head, I did explain to the mom what that meant. I said, our healthcare provider did not mean that she was making that up. But
so good. For a patient or a parent to misinterpret another provider, and for then someone else, a healthcare worker, to go in and explain what that means is critical. We deal with that in physical therapy all the time, where a patient comes in, they perceive something from their surgeon. I know the surgeon really well, and I tell them, I don't anticipate that's what they meant.
Right.
Here's what I believe they meant. I'll follow up with them to make sure we're on the same page. Yeah. But I've worked with them a really long time. They would not say that. Right. But because that's team approach, right? And rather than saying like, yeah, he's an idiot.
Yeah. And I said, what that actually means is that your brain is really powerful. And what's going on right now might be, we can actually create physical pain. So it's not that the pain's not real. The pain is real.
It is physically in your head because you're creating that, but you're not making it up.
Yeah. So we talked about that. We recovered there. And I went out and I said, advocated for this in particular medication. And he said, yeah, let's try it. Like, she hasn't got any sleep. Give it to her. That night I checked in. I think from 6 until midnight was like that last half of my shift. And I checked in every hour and I said, how's she doing? Do we need to like intervene, do anything? And he said, she's still asleep. And I was like,
of course she was.
So by the time I left,
if you knew how much, in my world, it was sleep, we talk about it with physical therapy because sleep influences pain so much. You end up getting irritated. Your nerves become so sensitive when you're lacking sleep. It actually creates pain. That could have been her main reason why she had pain in the first place. Yeah. Not saying it was. We don't know the actual outcome because we didn't follow that case through, right?
I know she was discharged the next day and she did not have to go to behavioral health. And I think ultimately it was, she needed the rest. And we all know that in the hospital setting, we don't get the rest that we need. But sometimes as healthcare professionals, we forget to advocate for those little things, know, and
absolutely.
Maybe it's even like sleep, eat, drink, just simple things like that, which a child life specialist can find creative ways to get those things done.
And I know the certain hospital that you work at has its issues and complaints, but it sounds like there's so much good that's happening there.
100%. Yeah.
And so much of the team that's working together. I think about all the problems in other businesses. Like, we can make complaints about plumbers and electricians and, all these different professions. And we can point fingers at healthcare that we have all these issues, but literally there's so much good. There's so many good things that are happening and teams that are working together and processing these things and debriefing and becoming better every day. Yeah. And we have our issues for sure. But ultimately, it sounds like you guys are doing it right. Would you agree?
I mean, I think there is room for improvement everywhere, but ultimately something that I would love for parents and patients, whether current or future, something to know is that like there is heart in those facilities. There are people that truly dedicate their lives to figuring out ways to better serve people. I literally walk in those doors every time, scan my badge, and I leave everything else behind. And my goal is to, if I can make somebody's life better that night, hopefully it's just one person, right?
Awesome. And what last advice do you have for parents, patients advocating for themselves and how it can help the healthcare team?
Tactfully speaking to your healthcare providers, being involved with the care. I know most parents are, and I can't speak on that level because I don't have a child of a chronic, I don't have a child with a chronic illness or chronic diagnosis. So I know that's a world that I personally can't seek for, but being involved and creating those relationships with your healthcare providers. They're people just like you, going through hard things outside of work. They experience life on their own too, outside of being a doctor, outside of being a nurse. Get to know them, and build that rapport with them so that the trust can be there, but also look into your resources, like people like me, people like child life specialists. Is there somebody else? Is there another profession here?
What resources
I've worked with music therapists, art therapists, movement specialists, people that most people would not even be aware of, that are a dance therapist in a hospital, that can be life-changing for a patient and could be the make or break for getting them discharged home, or, furthering their care in a way that actually gets them where they need to be. So ask the questions. Who else is here? What other resources do I have? Ask the questions.
Yeah, I love that. So be assertive, not aggressive, be tactful, be engaged, and look for your resources or ask for them. Yeah. If something doesn't feel right, doesn't make sense in your head, or doesn't feel good in your heart, ask questions. Right. You don't need to be rude. Like you see these patients that go online, these influencers, and they're just bashing these healthcare systems. Yeah. And essentially they're tearing it down. That's not what we're trying to do here. We're trying to build it up. Right. Don't be rude. Like, we're here to serve you. Yeah.
Find opportunities, if that's, in your abilities, to advocate for some of these things, advocate for other resources. Ultimately, it might just be a matter of speaking up for the team to realize what you do need. Yeah. So
last two questions, we'll wrap this up. I think everyone really wants to know, what's it like to build this business behind the scenes? And then what's it like to be married to me?
Oh no, we all knew that was coming, didn't we? This has been a journey, I think, for both of us, and we've been at it together for 6 years now. It's been hard. It's a hard thing to do. You're completely torn down by people left and right, that you can't do it. It's too hard. But it's been incredibly inspiring and empowering to get to where we are and to see it to come to life, because I saw it as a dream from, a young college student at 21 years old wanting to create this empire, to now seeing the empire. And it's incredible. And ultimately being married to Brad is challenging, but very, very inspiring. I've had moments in my own personal career where, I have my doubts or disbeliefs on what I'm capable of doing as an individual, and then seeing what he's overcome and what we've done, as a team, I then now see things differently. There are no barriers or walls, ultimately. And that's probably been, the best thing that's come from it. So.
Yeah. A lot of people don't know, I'm the face of all this, but not too many people know the heart of Foundation, and the biggest influence on all of the healthcare revolution and Foundation Physical Therapy and everything that we've done is you. You've been the one that's influenced it this whole time. And you're often you're more in the shadows than in the spotlight. And it's time people know, like, this is where most of my influences come from, is from you. The mind of the healthcare revolution has been you. It's been creating this team of collaboration and not tearing down walls, but building up teams, working together. So we appreciate what you've done for all of the community and what you do for healthcare. You make a meaningful difference, and you help sit with people through their hardest times, the deepest grief. And you do an amazing, incredible job advocating for you, your profession, healthcare in general. And you've done it for 18 years, and you keep going. And that's what I love about you, is you keep moving forward and you keep building the system. So thanks for being on the podcast today. It was an absolute pleasure.
Thank you.